process of the clinical evaluation center in the early morning hours, approximately 4 a.m. on the 1st?
Yes.
And who saw her there?
I think the psychiatrist's name was Dr. Outlaw.
Okay, and you're familiar with Dr. Jasmine Outlaw?
I've never met her.
Okay, but she is a psychiatrist on staff.
I don't know what on staff. What do you mean by on staff?
Well, she works at McLean.
Correct.
And so you were able to review the information she gathered in that first evaluation.
Yes.
And in reviewing that information, did you identify that the patient was identified as medically stable, right? Meaning she didn't have any acute medical issues that you had to worry about?
Correct.
And she was screened on the suicide screening?
Correct.
What was the chief complaint of the patient when she arrived at McLean?
She was unhappy. She was finding it hard to sleep if she didn't take medications.
Okay. And do you recall reviewing in the records that it was noted that she reported that she felt numb?
Yes.
And that she was having some issues managing medication?
I don't know what you mean by that.
Well, that she had some complaints about side effects or symptoms of medication?
Yes.
Now, when the psychiatrist and the clinical evaluation center gathered the information, fair to say that it's primarily based on what's reported to the doctor by the patient?
Yes.
At McLean, do you have access to a patient's full psychiatric history or all their records from other places?
It depends where the patient is coming from. I think that Dr. Outlaw did take an excerpt of the APS evaluation that was done at MGH, so I assume that she had access to that.
I'm sorry, assumptions?
I mean,
I should ask it in a different way.
No, she doesn't know.
Yeah.
Right.
As far as the full record of this particular patient that you were assigned to and responsible for, you reviewed all of the notes and information gathered by Dr. Alia on that first interaction with the patient, correct?
Yes.
And you indicated a little while ago in your testimony that McLean is affiliated with the Brigham Hospital and Mass General. So is it fair to say that those records from Mass General are available to you at McLean?
Yes.
And again, you indicated that that APS evaluation is something that's done at the emergency room, right?
Yes.
And is it common that that information come along with the patient?
I don't know.
No, good. Just if you could answer that. You don't know?
I don't know.
Okay, all right, next question.
In this instance, when you reviewed the records, were you aware or did you see that there was some notes to the APS evaluation from the Mass General ER?
I saw the excerpt of the APS evaluation in Dr. Outlaw's note.
Okay. And that excerpt from the APS evaluation was conducted by somebody by the name of Dr. Hogan, correct?
Correct.
And did you review a portion of the record indicating that the patient said to Dr. Hogan or reported thoughts of wishing to be dead but no plan?
Yes.
And that there was no violent or homicidal ideation, right?
Yes.
And that was observed at Mass General to have no evidence of psychosis, mania, obsessions, or current anxiety symptoms.
Correct.
So that's information that you knew before you met with the patient.
Yes.
And as far as what's reported when the patient comes to McLean, and in this instance when Lindsay Clancy came, are you aware she reported during that clinical evaluation center evaluation that at the beginning of December she had started Seroquel and Remeron and started to have intrusive and suicidal thoughts?
Yes.
That she attributed that to medication?
Yes.
Okay, and so what was the plan, the first plan that came out of that clinical evaluation center evaluation of Ms. Clancy?
She was continued on the medication she was admitted on. You know, the plan, they do the checks, they decide what medical monitoring you need, but she basically was admitted and the medications were the same.
And what was the security level, or how long were the checks assigned to her after this evaluation?
15 minutes.
And was she considered to be a high risk upon coming into the inpatient unit, or was she minimal risk?
Low. Minimal, yeah.
And were you aware of what's called the provisional diagnosis that was assigned to this patient when she arrived?
I don't recall what the provisional diagnosis was, but I do know that they do assign a diagnosis. I don't recall it. I must have seen it in the records, but I think there are like 5 different diagnoses.
Just referring to what's already been marked as Exhibit 79, I'm going to draw your attention to page 24.
Thank you. Right. Okay, I think I remember. Yes.
Okay, does that refresh your memory as to the provisional diagnosis?
Yes.
What was it?
Major depressive disorder, severe, without psychotic features.
Now, what does the provisional diagnosis mean to you? Are you free to change that based on your experiences with the patient?
The diagnosis I give the patient is dependent on what my interactions are and the observations of the team.
Now, for this particular patient, Ms. Clancy, on January 1st, when she got situated onto the unit after that first evaluation by Dr. Outlaw, are you aware that she was then seen later in that day on January 1st?
Yes.
And were you the doctor who saw her, or was there somebody else?
It was a different psychiatrist.
Okay, and who was the psychiatrist that saw her on January 1st?
It was Dr. Madva.
And that would be Dr. Elizabeth Madva?
Correct.
Again, is she a psychiatrist as well?
Yes.
And so this occurred while you were not in the hospital, right?
Yes.
And were you able to review the notes, the admission notes of Dr. Madva regarding her interactions with this patient on January 1st at approximately 12:47 p.m.?
Yes.
And again, as far as these interactions go with the patient and the psychiatrist, it's more of a conversation, right?
I'm sorry, can you repeat the question?
Yeah, it's a conversation when you meet with a patient.
Yes.
You ask them how they're feeling, get information that you think is necessary. Is that fair to say?
It's a conversation, and also you gather information.
Okay. And so do you rely on things that were reported before?
Yes.
But you also ask follow-up questions, right?
Correct.
And as far as your review of Dr. Madva's interaction with Ms. Clancy on January 1st, is it clear to you that she did that?
Yes.
You reviewed her history with her and spoke with her about how she was feeling?
Yes.
At the time she spoke with Dr. Madva, you where she said that she denied feeling depressed and denied any passive death wishes or suicidal thoughts, but reports feeling numb.
Yes.
She reports she can't feel any emotion other than mild anxiety now being in a hospital setting.
Yes.
Okay. After Ms. Clancy was seen by Dr. Madva, were you aware of what the plan was regarding her medication?
Yes.
And what was the plan?
Ms. Clancy complained, there were several symptoms. One of the things that she did complain about was the numbness, and Dr. Madhwa did, hear that and hear her concern, and that she had been sensitive to many different medications. So she.
Well, let me ask if I can ask a question.
You finish with your answer?
So she determined that it was possible that the numbness the patient was complaining of was a side effect of the medication she was on, and the plan was to taper that medication and observe the patient to see whether the numbness went away and also if any other symptoms became evident.
So the medications, you were aware of the medications that Ms. Clancy came into McLean on, right?
Yes.
And what medications were those?
Seroquel at 100 milligrams a day, at a Valium, 2 milligrams. I don't remember the frequency. I think it was per day. And
Again, we're gonna let her finish. Yeah, just say no problem. Yeah.
so Seroquel, Valium, and Benadryl.
Do you remember or do you recall Remeron being one of the drugs that were described or reported by Ms. Clancy when she came in, that she reported taking Remeron?
In the past, yes.
Okay. And again, in that report from the patient about past history, do you recall her indicating that one of the providers had suspected a bipolar disorder?
Yes.
In your interactions with Ms. Clancy and your review of the interaction she had with other psychiatrists, did she appear to agree with that diagnosis?
Did who appear to agree?
Ms. Clancy.
Rephrase that question, please.
Ms. Clancy, she disagreed with the diagnosis.
Okay. The fact that she came in and she was on 100 milligrams of Seroquel or more, would that have been something that was significant to you in considering a bipolar diagnosis?
Seroquel is used for several purposes. It is not just used for bipolar illness.
Okay. And Ms. Clancy also reported coming to McLean issues with insomnia, correct?
Yes.
Is Seroquel sometimes used in low doses to address insomnia?
Yes.
Now, as far as the plan from January 1st, you indicated that Dr. Madhva recommended reducing the Seroquel and then monitoring symptoms, correct?
Yes.
Okay. Were you aware that Ms. Clancy saw Dr. Madhva again on January 2nd?
Yes.
And again, that was prior to your first point of contact with her.
Yes.
As far as what you know from reviewing the record, you were aware that that Ms. Clancy reported that she slept well on lesser dose of Seroquel.
Yes.
Did she report any delusions, hallucinations, or suicidal or homicidal ideation?
No.
Okay. And as far as after the check-in with Dr. Madhva on the 2nd, was the plan to continue to decrease the Seroquel?
Dr. Madhwa was going to continue her on 75 milligrams, and then the next day she would have gone down to 50 milligrams.
And on these first few days that Lindsay Clancy was at McLean Hospital from January 1st until you actually saw her on January 3rd, you're aware that in addition to seeing Dr. Outlaw at the intake and Dr. Madhva on 2 occasions, on the 1st and the 2nd, that there were also notes in the record for you to review from nurses who interacted with her on January 1st at 5:20 a.m., right?
Yes.
From nurse January 1st at 6:28 a.m.
Yes.
A nurse interacting with her on January 1st at 10:34 a.m.
Yes.
And that she actually participated in a group activity with a social worker at 12:03 p.m. on the 1st.
Yes.
And that a nurse interacted with her and made notes at 2:07 p.m. on the 1st.
Yes.
And that she saw a mental health worker at 9:33 p.m. on the 1st.
Yes.
And in relation to January 2nd, a nurse made note of interaction with her on 9:46 on the 2nd, right?
I remember there were interactions. I don't remember the exact time.
But fair to say on the 2nd, she interacted with nurses and Dr. Madhva.
Yes.
Based on your review. Now, going to January 3rd, that was the first face-to-face contact you had with the patient, correct?
Yes.
Prior to meeting with her, had you reviewed all of these notes and all of the information up to that date?
Yes.
And did you go through, a report of history with her?
Yes.
Were you able to make an assessment of her mental status during that interaction with her?
Yes.
And what were your observations of her mental status?
I can remember certain elements, but I don't remember. She was dressed in, she was appropriately dressed. Her speech was of normal rate and volume. Behaviorally, she was polite and cooperative. Her mood, I don't remember exactly. It's a quote, so I don't remember exactly what she quoted her mood as being. It would be in the medical record.
Yeah, one moment. I'm just going to approach, if that's okay.
Yeah. And just on the records are Exhibit 79?
Yes.
All right, so those records, you'll have those with you.
So I have both 60 to 61 through 66. So that's your note. If you can just take a look at that. And let me know. Does that refresh your memory as to what your observations were of her mood?
Yes.
What was her mood?
Anxious.
Okay. And did you observe signs of anxiety, or did she tell you that she felt anxious?
She appeared anxious.
And her affect, did you observe it to be congruent to her mood?
Yes.
And you examined her and found her to have linear thinking and appear goal-directed, right?
Yes.
And as far as addressing kind of why she was there and what your recommendations were, ultimately, what were you trying to address or accomplish in the treatment plan with Ms. Clancy?
That's a very broad question.
Okay, I can break it down if that's okay.
Yes.
So as far as once you had a chance to sit and talk with her, what did she identify to you to be her main concerns that she wanted to address during her stay at McLean?
She did not want to be dependent on an antipsychotic medication, which is what Seroquel's class is, even though it's used for insomnia and other indications, depression. She didn't want to be dependent on Seroquel to be able to fall asleep.
Okay, and so fair to say she was very concerned about wanting to sleep at night.
Yes.
And she was very concerned about her symptomology, or what she was experiencing by way of symptoms from various medications, right?
Yes.
And that concept, or the phrase numbness, did she use that a few times?
Yes.
And again, you mentioned Dr. Madva was concerned about the numbness with the medication. In your experience with Seroquel, is that also a common side effect for people to feel numb?
It can be one of the side effects that people can have.
Okay. And as far as the suicidal statements that you were aware of from the prior reports, did you go through that with her about whether she presented to you with suicidal ideation?
Can you ask me that again?
Sure. Did you talk to her about her thoughts of suicide?
Yes.
And did you talk to her about whether she had any specific plan?
Yes.
Did she have any plan?
No.
Had she reported that she had ever had a plan for suicide?
No.
And did she tell you there were reasons why she thought she wouldn't commit suicide?
Yes.
And what were those reasons?
Her children and her family, her mother.
So after this face-to-face interaction with her and kind of going through her history and having reviewed what you had, the information you had about her, what did you develop as a plan for her while she was at McLean?
I continued with the plan to taper her off Seroquel and to monitor whether her symptoms improved, but also to see if she could sleep while she was off of Seroquel, and to really observe symptoms and mood.
During this first interaction with her, was there any conversation about how long she would stay or what her plan might be after she left McLean?
When we met the first time, Lindsay said that she had her daughter's birthday coming up on the weekend, and that it had been planned months ahead of that date, and she was hoping that she could be there that weekend so she could be with the kids and family.